So in rural areas specifically, if the area had higher deprivation, so less economic opportunity, there were higher suicide rates than a rural county that had a lower level of deprivation. In more urban areas, locations that had a large number of gun shops had higher suicide rates than a similar urban area that just had fewer gun shops available. The higher the uninsured population, the higher the suicide rate, and that is potentially because people who are not insured aren't able to access care. It's more expensive, they can't afford it, whereas those who have insurance can at least get part of that covered, whether it's to see a mental health or even a primary care provider. The main factor to make rural suicide rates higher than urban areas was deprivation. So the lack of economic opportunity, lower education, those factors are what really have a big impact in rural counties. In rural areas, to potentially reduce the suicide rate, I think education opportunities, employment opportunities would be good programs to initiate and to help reduce that and alleviate some of the stress that comes from low income. How to seek help, where to seek help, expanding the telemedicine, telehealth would also bring access to mental health and even health care to a lot of rural residents that could help reduce suicide rates.
We found that rates of suicide in rural areas were higher than in urban areas. And we found that social deprivation was poverty, low income, unemployment was associated with suicide. The rate of suicide has increased by 30% over the past decade. And it's increasing more in rural areas than in urban areas. And the disparity is increasing over time. They have to travel longer distances, deal with waiting lists. Rural residents tend to also have lower incomes, less likely to have insurance compared to urban residents. So this all plays a role in keeping less access to mental health services. Educating primary care physicians about mental health diagnosis, depression, and suicide can be really effective because primary care physicians are the first frontline workers that residents tend to go to, and because there's also less specialty care in rural areas. Improving healthcare coverage is a long-term goal because a lot of rural residents are uninsured. We found that being uninsured is a big risk factor for suicide. We know that living in a rural area, you tend to be more isolated geographically, and you're not close to neighbors, and so you don't see a lot of people. You don't have a lot of one-on-one contact, which increases the rates of depression.